Good day once again, fellow learners. This is your mentor, Ray, your fact check buddy, Ray Gapuz, joining you for another teaching and learning session. And this time around, we're going to talk about myocardial infarction and sexual activity. Well, this is one of the most common concerns of MI patients. There are questions that arise like, when can I engage in sex? Remember, this is a physiologic need and it helps the body to relax. So whether we like it or not, even post-MI patients should engage in sexual activities. Okay, but before that, let me invite you for the global launch of my new book. It's entitled NCLEX RN Quick Fix in Pharmacology. And that's going to be on May 28, 2022 at 9 a.m. Pacific Standard Time. I'm going to be giving out 100 copies of my book. And I'm going to conduct a quick fix session in pharmacology. So to reserve your slot, kindly email info@regapuzreview.com or text or call our hotline 0906-201-9383. I'd like to see all of you there because, you know, one of the common trends nowadays on the tests is actually about drugs. So I'd like you to be focused on the most important drugs that you need to remember for the test. So I'd like to invite also everyone to join us in this mission. Our goal is to provide free NCLEX RN application and review, 200 nurses to help us achieve this. Just watch and finish the ads in our videos. You don't have to do anything special. Just watch our ads and please, please finish the ads. Thank you in advance. So let's begin with an inspiration from the mail. First and foremost, a shout out to one of our recent passers, okay, Heaven Jane Sabihon of De La Salle Medical and Health Sciences Institute, who passed the NCLEX RN in the State Board of Virginia last April 27, 2022. And of course, we have also an inspirational email coming from one of my students. His name is Brian, and he says, I passed the NCLEX. Sir Ray, my heart is still smiling every time I remember my NCLEX journey. I am humbled and ever grateful to you and to the other mentors. You made me realize that I could pursue my American dream even with my age. My nurse licensure was 2005 and I took it 16 years ago, so you can just imagine. So he's a believer of ageism, equating everything with advancing age. That's not necessarily true. Okay, it took me 16 years to take the NCLEX. I reviewed in your center. For 4.5 months of lecture, self-review, dedicated hours of watching your online videos almost every day, I'm proud to say that I am now a USRN. Shout out to the fathers like me, not to give up on your American dream. Dedicate time and believe in yourself. And Sir, thank you. And pray always. Thank you, Sir Ray. Always proud and loud to be a Gapuz baby. My heartfelt gratitude. Congratulations, Brian. So I actually congratulated Brian through his email address. Okay, so now on with our focus. It's going to be MI and sexual activity. So let's try answering a sample question. Here we go. Which of the following statements made by a patient being rehabilitated for myocardial infarction reflects knowledge deficit? And then you have several options. Now, there's no way you would be able to answer this question if you are not equipped with the latest advisory from healthcare providers and, of course, the American Heart Association. So before we answer this question, before we crack it, let us first recall some functional concepts. Let's begin with the first one. In myocardial infarction, death of heart muscles occur due to decreased blood flow. And the decrease in blood flow is brought about by a blockage in the arteries, which converts aerobic metabolism to anaerobic metabolism, which simply means the metabolic process that usually takes place with oxygen now becomes anaerobic, which simply means it's taking place without adequate oxygen. So in essence, the heart muscles would have difficulty pumping because of the lack of oxygen. So let's also go over some key points related to myocardial infarction. In myocardial infarction, initial changes in the EKG include large peak T waves or hyperacute T waves, followed by ST elevation and T wave inversion. And finally, the irreversible pathologic Q waves develop. So if you want to find out about which EKG wave would still be identifiable with a history of MI, it's going to be the pathologic Q wave, because it is something that is irreversible. Now, crushing chest pain that is usually more than 30 minutes, and then shock eventually develops. Now, what are the common risk factors to myocardial infarction? It's more common in males, those with diabetes mellitus, hypertension, elevated cholesterol, and the smokers. And of course, those who are obese and whose lifestyle could be sedentary. Okay, cardiac biomarkers, you have troponin and creatine and phosphokinase elevate after myocardial infarction. So C-reactive protein may also indicate cardiac inflammation, and it could also help in the diagnosis of MI. Now, here we go. Aspirin is the first line of treatment in all suspected MI patients. Why? Because the priority goal of care is to prevent the enlargement of the clot and to prevent the formation of new clots. And that could only be done by thinning the patient's blood. So if thrombolytics or fibrinolytics are not yet available in a patient who had MI, then aspirin should be given to the patient. Now, your concern could be, if aspirin thins the blood and may potentially cause bleeding, and fibrinolytics or thrombolytics, which are best given within 3 to 4 hours after myocardial infarction, could also thin the blood, okay? Do we need to still administer the thrombolytics despite the fact that the patient has already received a blood thinner? The answer is yes, because the priority goal of care is to prevent the formation of new clots, prevent the enlargement of existing clots, and your thrombolytics will dissolve the clots. So in essence, also remember that the presence of a menstrual period in a female patient is not a contraindication to the administration of thrombolytics or fibrinolytics, like your tissue plasminogen activator. Now, nitroglycerin could be given orally or IV, is a standard treatment for patients with MI. And take note, the initial goal of care is to decrease anaerobic metabolism. Pay particular attention to that initial goal of care. Now, on to our concern. After a heart attack, what do we tell our patients? First, if they ask us about when they can potentially engage in sexual activities, well, there are guidelines that says a week after. There are also guidelines that says if they're able to go up 2 to 3 flights of stairs without dyspnea. But in a general sense, that is not true for every patient. So what we usually tell them is to resume sexual activity when they are healthy, and that they have to start slowly. Now, the primary concern is that, will the tachycardia that occurs with foreplay be contraindicated in MI patients? The answer is no. Actually, foreplay like hugging, kissing, caressing, or touching helps relax the body, and it prepares the body to the physiological changes that may occur during sexual activity. Now, the best time to engage in sexual activity is after a nap, or 1 hour after a meal, or after taking a bath, or after having adequate rest after any other activities. And whenever the patient feels chest pain or shortness of breath while having sex, they need to stop, okay? And then if it goes away, they can resume. But if it occurs again, then they need to call their healthcare provider. So if they are supposed to engage in sex, they need to take the nitroglycerin before engaging in sex. And the most important thing, the one with the MI should assume a passive, comfortable position when having sex. Passive position could mean that they could be lying on their back or side lying. So let's now go back to the sample question and try answering. Which of the following statements made by a patient being rehabilitated for myocardial infarction reflects knowledge deficit. So this is an important phrase for you to note. Knowledge deficit means we have to look for false statements or incorrect statements or statements that we need to clarify or statements that we need to correct. One, I can resume sex when I feel ready for it. Yes. Now, this is true. Therefore, it is not reflective of knowledge deficit. Remember, we're supposed to be looking for something that's false. And we said a while back that the patient can resume sex whenever they feel healthy and ready for it. And some guidelines would actually say that's going to be a week after. If the patient has had surgery, it's going to be 1 month to 1.5 months or 4 to 6 weeks thereafter. MI is rarely caused by sexual activity. Is this reflective of knowledge deficit? No. Now, there are studies that say that there is no direct link between sexual activity and myocardial infarction. It could potentially, there's the potential, but we can say, therefore, that it is not directly related to the development of MI. So sexual activity add on to the difficulty of the heart once it is, once the patient has already been diagnosed with myocardial infarction. But to say that sexual activity is a cause of myocardial infarction, no. Okay, so that is not true. So therefore, MI is rarely caused by sexual activity. You have a qualifier here that says rarely. This statement is true, and we're supposed to be looking for a false statement because of the phrase knowledge deficit. Okay, next, I need to take my medication before having sex. Once again, this is true. So we put an X because we are supposed to look for the false statements. And then I will need to avoid foreplay to lessen tachycardia. What did we say? Foreplay helps prepare the body for the physiologic changes that could potentially occur when the patient engages in sexual activity. So this indicates knowledge deficit. So we put a check. It is best to have sex before taking a nap. What did we say? Supposed to be an hour after taking a nap, an hour after taking a bath, or an hour after an activity, or after the patient should have rested. So saying otherwise is indicative of knowledge deficit. So we put a check. So there you go. I think we have a very, very fruitful discussion about this. So a copy of the slides in this presentation can be sent to your email once you request for it. And you can actually send your request by email at gapuz.mentors@gmail.com. So let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com, if you have other topics in mind that you want me to cover in my future videos. So this is your mentor Ray, your fact check buddy, saying a functional concept a day keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe, share, and hit the like and bell notification buttons so that you'll get updated as we upload new videos on a weekly basis.